You mentioned that advanced directives has been one of your missions in your job and in your goal. What other I guess what other advice that would you have for families, especially families taking who have you know um, yeah, geriatric patients, older patients, or parents. As far as from your point of view, what kind of things can they do, before there's a crisis situation, to help out their family members?
Well, some of the stuff that I wish a lot more families understood or were prepared for involve advanced directives, but also understanding the difference between facilities. Um, a lot of my time is spent explaining different facilities. A lot of people think that all nursing homes are pretty much the same, that you can just pick one, go with it, that all of them magically have empty beds available when you want to place mom or grandma there. And a lot of people don't understand the difference between an assisted living or independent living even and an actual skilled nursing facility and the difference in cost. Insurance doesn't cover assisted living. It's usually an out-of-pocket expense, although Medicaid there's a Medicaid waiver program, but as of right now that involves a pretty significant wait a lot of the time. Um, so it's just important for people to understand where their loved one is in the stages of their dementia. I would recommend if you have someone who's diagnosed with dementia or you have concerns about their memory or their cognitive ability and you think they might have dementia, it's important to have them screened regularly um, and keep track of where they're at with their dementia, because depending on where they're at with that progression, that plays in a lot to what kind of facility they could be placed in, or for you to gauge when it's time for them not to be at home anymore. There are a limited number of nursing facilities that will take someone who is at a point with their dementia where they're consistently combative or agitated, frequently need PRN medications, or can't be trusted not to wander off. It's important to know the difference between all those facilities. And that's a lot of my time is spent doing that, kind of giving lists of all the county facilities and then marking each one. This facility is not really appropriate for mom. This facility rarely has beds available. A lot of the nicer facilities, it's going to be a long waiting list. And it's also important to know what to look for when you go into a nursing home. A lot of these places will, I'll get a patient who he or she is pretty advanced with their dementia, and we need a locked dementia unit, locked behavioral dementia unit on a nursing home, and there's 4 or 5 in the county, and I'm working with the family to try and have them tour those specific facilities, but they're looking at this really beautiful facility on a lake that Aunt Margie went to, and she had a wonderful stay, and they have a chef there, and it's just, you have to keep in mind what's important. Each facility spends money differently, and they staff differently, and the cost is different based on, what they focus on. A lot of these facilities that are beautiful have great upholstery, they're in great locations, they always have long waiting lists. They have that money to spend because they don't have to spend the money on increased staffing for behavioral patients. So if you have dad frequently tearing out of the house with no clothes on and he's punching people and he's throwing kicks and he needs to be kept safe, that facility is not appropriate. You need to be looking at a place that maybe the decor is not up to date, but they have twice as many nurses on staff every day. And it might cost a bit more, but you're paying more to have more nurses per patient. And it's important to look at all of those things.
I'm so glad that you brought that up because I do have that discussion with my patients and families as well. And there's a myth out there that if they bring mom or dad to the ER in a crisis situation, they'll be able to pick exactly what type of facility that they can go to because of whatever. And it is all of those factors that you've mentioned as far as the complexity of care, not only their complexity of medical care, because some of these patients have complex medical diagnosis too, in addition to their mental health diagnosis, and is that facility appropriate for that person, especially if they do have Alzheimer's or dementia? Are they going to be wandering off? I've had a lot of stories, and you probably heard a lot of them too, where patients were put in the wrong facility for them, and they just walked out the back door, and they couldn't find them for a few hours because they needed a special type of unit where they can't walk off the floor, they can't walk out of the building. So that's another type of situation that families have to consider, and also the cost as well. Most insurances, they don't pay. Actually, all of them don't pay 100% spend, except if they're qualify for a skilled type of unit or that type of thing. But all the amenities, you're right. All the amenities, patients and families have to pay for out of pocket, and I think that's a myth out there. And you're right. Families and patients kind of definitely have to know this before this crisis situation happens, and you're right, it usually never happens, and it takes someone like you to really explain this, which can be very frustrating, I would presume, because this is their usually their parents or their grandparents, and trying to navigate families through this system is very frustrating.
There's a lot of people focus on things that are important, but aren't as important as, is the patient going to be safe? A lot of people focus on location and what the nursing home looks like, which are two of the least important things when it really comes to, it's one thing if grandma's 92 and she's got all her faculties about her, and she just needs to be in a place that's going to give her her medicine on time and is going to prepare her meals for her and has, a nice atmosphere. That's one thing. But if you're dealing with a patient on my unit, I'm coaching those families, usually redirecting them away from focusing on, well, that's too far from my house, or I went in there and all the pictures on the wall were old and the carpet was old, and, I'm usually coaching those families to say, look at how many nurses are working, look at how many patients there are, and look at how many nurses there are. Go into the nursing home when you have not scheduled, a visit, and look at how they're go in during a meal time. That's a really great time. It usually is a little hectic. Look how they're handling that. The other thing is, if I tell you grandma needs a locked unit or mom needs a locked unit, I'll usually say they need an actual locked unit. A lot of nursing homes will claim to have a dementia unit, and then they use things like wander guards, which just set off an alarm if the person wanders away from a certain area, or they have locked doors that aren't really locked, where if you push on them for more than a certain number of seconds, they open anyway. And there are certain patients, and there's a certain type of dementia behavior that is not safe. So I usually, I usually do a lot of clarifying with that. Look at the staffing, look at how they handle things, and if they tell you they have a locked unit, ask them what they mean by a locked unit and ask them to explain it. And also describe the behavior that your loved one has, like what type of behavior do they display, and then ask them for specific examples of patients they've had like that and how they've handled that situation very specifically. And you'll either find out that they haven't had patients like your mom or your grandma, and that's not a good sign, or they've handled it, and if you ask them for specifics and they have trouble giving you specifics, that's not a good sign either. They should have very clear and concise answers and examples of many people they've handled who are just like your loved one, so that they're prepared for the kind of behavior they're going to see when you move him or her in.